All right, so we've got this stack of research here all about cirrhosis, and I got to be honest with you, I always thought it was, like a concern for people who maybe, um, let's just say, enjoy themselves a little too much in their younger years.
Yeah.
But looking at all this research, it seems like it's a way bigger deal than I realized.
Yeah.
Maybe we should bring in our expert to, like, break this down for us.
Definitely not just something you see in old movies with, like, people sitting around drinking whiskey all day.
Right.
Cirrhosis is way more common and way more complicated than a lot of people think.
Okay, well, let's unpack that then.
Yeah.
So first things first, for those of us who maybe slept through high school health class, can you give us a little refresher on what cirrhosis actually is?
Yeah, of course. So cirrhosis is basically what happens when healthy liver tissue gets replaced by scar tissue.
Okay.
So you can kind of think about it like getting a scar on your skin, but it's happening internally to your liver.
Mm.
And over time, as you can imagine, that scarring makes it harder for your liver to do its job, which is a pretty big job, by the way,
Right.
because your liver filters toxins, it produces bile, it helps with digestion, it does a lot.
It's like the unsung hero of your organs,
Yeah.
working behind the scenes.
Right, exactly.
So how common is this whole internal scarring thing? Like, are we talking about a small percentage of the population? Or
Well, a recent study actually found that a staggering 2.2 million adults in the U.S. have cirrhosis.
2.2 million? Wow.
Yeah, that's like the population of a whole city.
Yeah.
And here's the real kicker. It's not just a concern for, older generations anymore.
Well,
We're seeing a really concerning rise in cases, particularly among younger people.
younger people. Whoa. Okay.
Yeah, and a lot of that is being driven by alcohol.
Huh. I guess our assumptions about who's at risk for cirrhosis could use an update.
Yeah.
You mentioned that a lot of these new cases are linked to alcohol. But I thought there were other causes too, right? Like, what else is going on with cirrhosis?
Oh, you're absolutely right. Alcohol is just part of the story. For a long time, hepatitis C was a major culprit.
Right.
But thanks to these new antiviral drugs, it's actually curable now.
Oh, wow. That's amazing.
So that's the good news. The not so good news is that the fastest growing cause now is something called NFLD,
NAFLD.
which stands for non-alcoholic fatty liver disease.
Okay. So not alcohol, but still fatty liver disease.
Exactly. And it's often linked to things like obesity and diabetes.
So it's like this double whammy, more alcohol-related cirrhosis in younger people.
Yeah.
And then this NFLD becoming more common overall.
Yeah, unfortunately.
I have to say, I'd never even heard of an NFLD before we started looking into this.
Yeah, there are a lot of misconceptions out there about cirrhosis.
Really?
And that's why it's so important to have these conversations.
For sure.
To, really unpack it all.
Yeah. Okay, so we've established that cirrhosis is more common and more complex than a lot of people realize. But what does it actually mean for your health? Let's talk symptoms.
Yeah.
I think a lot of people, when they think about liver problems, they think about jaundice, that yellowing of the skin.
Right.
Is that accurate?
Well, jaundice can be a sign of liver problems, including cirrhosis,
Okay.
but it's not always present, especially in the early stages. And cirrhosis can actually manifest in some pretty surprising ways.
Like what?
Well, we're talking muscle cramps that are so bad they can keep you up at night.
Oh, wow.
Constant itching, all over,
Really?
even sexual dysfunction.
Wow. I had no idea.
Yeah.
It could manifest in so many different ways.
Yeah. And these are all things that can really impact your quality of life, often in ways that people don't associate with their liver.
It's like you don't think about it until your liver is really unhappy.
Exactly.
So it's not just about like how much you drink or whatever. It's this whole other, it's a whole other beast.
It's complex.
Yeah. And that's why it's so important to be aware of like all these different symptoms and to talk to your doctor if you're experiencing any of them, even if they seem like unrelated to your liver.
100%.
That's why we do these deep dives, man.
Yeah.
Uncovering the unexpected.
Yeah.
So we've got these really diverse and frankly kind of scary symptoms.
Yeah.
But before we jump into treatment options, let's talk about the complications of cirrhosis. You sent over some research on like 4 main ones, and I have to say the names alone sound pretty intense.
Yeah, they're nothing to mess with.
Can we break them down one by one? Starting with variceal hemorrhage.
Well, sure. So variceal hemorrhage, that sounds scary, and for good reason. Essentially, it's internal bleeding.
Oh.
But not just a little cut. We're talking bleeding from the veins in your esophagus.
Your esophagus. That's the tube that carries food from your mouth to your stomach, right?
Right, exactly.
Okay, yeah, that sounds pretty intense. What causes those veins to, start bleeding in the first place?
Well, it all comes back to the liver. You see, Your liver normally processes blood from your digestive system, but when your liver is all scarred up, the blood can't flow through it as easily.
Ah, okay.
So it creates this traffic jam,
Eh.
and that increases the pressure in the surrounding blood vessels, including those in your esophagus.
Right.
Over time, those veins can become enlarged and fragile, kind of like overinflated balloons,
Oh, well.
and eventually they can rupture.
So it's like the liver's dysfunction is messing with the plumbing throughout that whole system.
That's a good way to put it.
And I'm guessing a ruptured blood vessel in your esophagus is not something you want to mess around with.
You are absolutely correct. Variceal hemorrhage is a very serious complication that requires immediate medical attention.
Okay, that's one down, and frankly, it's enough to make me want to take extra good care of my liver.
Mm-hmm.
But we've got 3 more to go. What about ascites? What is that?
So ascites is a buildup of fluid in your abdomen,
Okay.
which can be incredibly uncomfortable.
I bet.
Imagine feeling constantly bloated.
Yeah, no thanks.
But poof, times 10.
Oh my gosh.
And this happens because that increased pressure in the liver's blood vessels, that same traffic jam we talked about, it forces fluid to leak out into the abdominal cavity.
So it's like your body is trying to compensate for the liver's dysfunction, but in doing so, it creates this other problem.
Right. It's like trying to relieve a traffic jam by diverting cars onto smaller side roads.
Right.
It might help a little bit, but it can also lead to congestion and problems elsewhere.
It's all connected.
Exactly.
All right, so that's 2 pretty heavy complications. Internal bleeding and fluid buildup. What's next?
Next up is hepatic encephalopathy.
Hepatic okay. You're going to have to help me with that one.
Hepatic encephalopathy. And this is where things get particularly interesting because it directly affects the brain.
Oh, okay. So this is serious stuff.
Yeah, so basically hepatic encephalopathy happens when toxins that the liver normally filters out, they start building up in the bloodstream, and eventually they can reach the brain.
So it's like the brain is being poisoned by the body's own waste products because the liver isn't doing its job.
Exactly. And the symptoms can range from mild confusion and forgetfulness to more serious cognitive impairment, personality changes, and even coma in severe cases.
Okay, wow. We went from bad to worse there.
Yeah, it's not good.
So we've got internal bleeding, fluid buildup, and now potential brain damage. I'm starting to think we need a whole separate deep dive just to process all this.
Maybe so.
But we're on a roll, so let's tackle the last one. Hepatorenal syndrome. What is that, and how does it fit into this whole picture? Okay, we've covered 3 major complications of cirrhosis, variceal hemorrhage, ascites, and hepatic encephalopathy. Each one scarier than the last, I have to say. That brings us to the final one you mentioned, hepatorenal syndrome. What is that, and how does it fit into this whole picture?
All right, get ready for a twist. Because hepatorenal syndrome, it's not directly about the liver or the brain. It's about the kidneys.
The kidneys.
Okay. Yeah, so when your liver is severely scarred, it can actually disrupt blood flow to your kidneys. And since your kidneys rely on a healthy blood supply to filter out waste and excess fluids, well, things can go downhill pretty quickly.
Wow, so the liver's dysfunction is like this domino effect that impacts other organs in a big way. It really shows how interconnected everything is.
It really does.
So when cirrhosis starts affecting your kidneys, are we talking about what's the treatment at that point?
Yeah, that's where things get a bit trickier. Remember how we talked about medications and lifestyle changes being really important for managing cirrhosis early on?
Right.
Well, with these serious complications, sometimes those things aren't enough. We might be talking about procedures, surgery, even transplants in some cases.
Okay, so let's delve into that a little bit. You sent over some research about a procedure called TIP-S, which, full disclosure, sounds terrifying to me just based on the name.
Yeah. The name is definitely more intimidating than the procedure itself.
Okay, good.
TIP-S stands for transjugular intrahepatic portosystemic shunt.
I see. I'm already lost.
I know, right? Basically, it's like creating a detour for the blood flow in your liver. Remember that traffic jam we talked about?
Yeah.
TIP-S is like building a new road to bypass the congestion.
Okay, so creating a bypass for blood flow. That sounds intense, but also kind of ingenious, like you're giving the liver a little bit of breathing room.
Yeah, that's a great way to think about it. Of course, like any medical procedure, TIP-S comes with its own set of risks and benefits.
Right, so it's not a decision you make lightly.
Right.
So we've talked about these 4 major complications and some potential treatment options. But I imagine early diagnosis is key here, right?
Absolutely.
The sooner you catch cirrhosis, the better your chances of managing it effectively. What's the deal with diagnosing this?
You're absolutely right. Early diagnosis is crucial. And thankfully, we've made a lot of progress in that area.
Okay, good.
For a long time, a liver biopsy was the gold standard for diagnosing cirrhosis.
Which is basically sticking a needle into the liver, right? To get a tissue sample.
Yeah, that's the gist of it.
Ouch. Doesn't sound like a fun time.
No, it wasn't exactly a walk in the park. But here's the good news. These days, we have a range of non-invasive tests that can help diagnose cirrhosis and assess its severity without needing a biopsy.
Okay, phew. That's a relief. So what are these magical non-invasive tests?
One commonly used method is called elastography,
Elastography.
which is a fancy way of saying it's a painless imaging technique that measures the stiffness of your liver.
Okay.
You see, the more scarred the liver becomes, the stiffer it gets.
So it's like giving your liver a little poke to see how firm it is.
Yeah, something like that. We also use blood tests in new and innovative ways to diagnose and monitor cirrhosis. For example, there's this fascinating algorithm that takes into account your age, your blood work, and believe it or not, even things like how clumsy you've been lately to help determine your risk.
Like clumsy. So if I'm tripping over my own feet more often, that could be a sign of liver trouble.
It might sound strange, but it actually makes sense. You see, when the liver isn't functioning properly, it can lead to a buildup of toxins in the bloodstream, which can affect your brain function and your coordination.
Wow. The human body is a fascinating and complex machine. It's like everything is connected, and even these seemingly small things can provide clues about our overall health.
Right. It's incredible.
So we've talked about diagnosis and the serious complications that can arise from cirrhosis. But what about treatment? Aside from like addressing those specific complications, what can be done to manage the condition itself and prevent it from progressing?
That's the million-dollar question, isn't it?
Right.
And that answer, as with most things in medicine, is that it depends. It depends on the underlying cause of the cirrhosis, the severity of the liver damage, and the individual's overall health and lifestyle.
Okay, so let's break it down a bit. Let's say someone is diagnosed with cirrhosis in its early stages. What are like the typical steps for managing the condition?
Well, the first and most crucial step is addressing the root cause. So, if the cirrhosis is alcohol-related, then abstaining from alcohol is absolutely paramount.
So not just cutting back, we're talking like no alcohol at all.
Exactly. For people with alcohol-related cirrhosis, even small amounts of alcohol can cause further damage and accelerate the progression of the disease.
Wow, that's serious.
Yeah.
But what about cirrhosis that's not caused by alcohol, like NFLD, which we talked about earlier? What's the approach there?
So NFLD is often linked to lifestyle factors like obesity, diabetes, and insulin resistance. So for those individuals, lifestyle modifications are key.
Okay, so like, what does that look like in practical terms?
Well, it includes transitioning to a healthy diet that's low in processed foods, saturated fats, and sugary drinks, and getting regular exercise.
So basically the same dietary advice that's good for everyone, but even more critical for someone with NAFLD.
Exactly.
What about exercise? Does that play a role?
Oh, absolutely. Regular exercise is hugely beneficial for liver health. It can help improve insulin sensitivity, reduce liver fat, and enhance your overall well-being.
So hitting the gym or even going for a brisk walk can actually help your liver recover.
In a way, yes, exercise won't magically reverse the damage that's been done, but it can create a more favorable environment for the liver to repair itself and function more effectively.
Okay, that's encouraging. So we've got abstaining from alcohol for alcohol-related cirrhosis and lifestyle modifications for NAFD. What about other causes like hepatitis B or C? What's the treatment approach there?
So for viral hepatitis, antiviral medications are the mainstay of treatment.
Okay.
These medications can help suppress the virus, preventing further liver damage, and in some cases, they can even lead to a cure.
So even though there's no like one-size-fits-all solution for cirrhosis, there are effective treatments available depending on the underlying cause.
Right.
What happens if the cirrhosis has progressed beyond those initial stages? What are the options then?
Yeah, that's where things can get more complicated. If the liver damage is severe and those initial treatments haven't been successful, a liver transplant may be the only option.
A liver transplant. That
That's
sounds like
okay.
a major undertaking.
It is a major surgery, but it can also be a life-saving procedure for people with end-stage liver disease.
So it's like a last resort, but a powerful one.
Exactly. And thankfully, advances in medicine and surgical techniques have made liver transplants much safer and more successful over the years.
Well, that's good to hear. Now, you mentioned earlier that there's a lot of like really exciting research happening in the field of cirrhosis treatment.
Oh, yeah.
Can you tell us more about that?
There's a lot to be excited about. For example, remember how we talked about the gut microbiome and its connection to liver health?
Yeah, that whole idea that our gut bacteria play a role in liver disease, that blew my mind.
Right. Well, scientists are now exploring ways to manipulate the gut microbiome to actually improve outcomes in cirrhosis.
Wow.
One promising approach is fecal microbiota transplantation, or FMT.
Right, the transplant, where you basically give someone a new set of gut bacteria. How's that research coming along? Right, the transplant, where you basically give someone a new set of gut bacteria. How's that research coming along?
It's showing a lot of promise. Early studies suggest that FMT could help rebalance the gut microbiome in people with cirrhosis, potentially reducing inflammation and improving liver function.
So it's like, instead of just treating the symptoms, you're kind of hitting the reset button on the gut,
Yeah.
giving it a chance to heal and support the liver.
That's a great way to put it.
It's a whole new way of thinking about liver disease.
Hmm?
What else is on the horizon? You mentioned stem cell therapy earlier.
Oh, yeah. Stem cell therapy is incredibly exciting. It has the potential to be a game changer, not just for cirrhosis, but for a whole range of diseases. In the context of cirrhosis, the idea is to transplant healthy stem cells into the liver, where they could potentially regenerate damaged tissue and restore function.
So instead of just managing the scarring, you're talking about actually reversing it.
That's the hope. It's still early days for stem cell therapy in cirrhosis, but the research is very promising.
It really seems like the future of cirrhosis treatment is just wide open with possibilities. It's amazing to think that something that, we used to think of as irreversible might actually be treatable, even curable someday.
I agree. It's definitely a reason to be hopeful.
This whole deep dive has been a great reminder that knowledge is power. The more we understand about cirrhosis, the better equipped we are to, take charge of our health.
100%.
Advocate for ourselves, advocate for our loved ones.
Couldn't agree more.
Well, I think we've covered a lot of ground today. We've debunked some common myths, explored the complexities of cirrhosis, even taken a peek into the future of treatment. What are your final thoughts for our listeners?
I think the most important takeaway is that cirrhosis is not a life sentence. Yes, it's a serious condition, but with early detection, proactive management, and a commitment to a healthy lifestyle, it is possible to live a full and meaningful life.
I love that. Hope and a call to action.
Absolutely.
And with all the advancements happening in research, there's even more reason to be optimistic.
For sure.
So remember, if you have any concerns about your liver health, talk to your doctor. Don't wait for symptoms to appear. Early detection is key.
So important.
All right, and on that note, we'll wrap up this deep dive into cirrhosis. Thank you for joining us on this fascinating exploration.